Well, hello there. Welcome back to Break It Down. My name is Asari Ndem, and I'm here with my co-host.
My name is Chibike Alaboso, and I'm glad to be back.
Yeah. And with us in the studio today is a very lovely lady. Please introduce yourself.
Thank you. Oh my gosh, I'm so lovely. My name is Kemisola Agbaoye. I am Director of Programs at Nigerian Health Watch.
Well, this is episode 1 of season 1 of the Break It Down podcast. If you've listened to us before, you were listening to pilot episodes.
Yeah.
Welcome to season 1.
Like test transmission, yeah?
Yeah. And in this episode, we're talking about health insurance. And we have
important.
like our in-house health insurance guru here with us.
Mm-hmm.
So Kemi, please, can you run us through very quickly what health insurance is?
Yes. If a roadside mechanic asks you, Madam, what is health insurance? All this thing we hear every day. What is even health insurance? If you go to fix your car and your mechanic is keen to know. Not to say that all mechanics are, I don't know about, just average Nigerian.
Yeah, I mean, well, since you use the example of a mechanic, then I would say health insurance is, and I'll use an example I think I've heard you use before, Chibike. It's you know how subsidy has been removed now and there isn't money. So if you had the opportunity before now to put money together and pay it to, say, Total, lots of people already do this. They have their cards. And you pay a certain amount, like a blanket figure, upfront, and you give it to Total or something. So anytime you need fuel, you just drive into Total and you fill your tank and you keep going. And it doesn't matter how much you end up spending. Doesn't matter how many times you come in to get fuel. You can go in there.
Really?
And the idea is that when so many people do this, you've pooled funds together and you're sharing risk. So a lot of people really just take a premium. We call it premium, a certain amount. Ranges depending on whether it's the National Health Insurance Scheme or private health insurance. And you just pay it to a health maintenance organization or to NHIS itself, depending on which one you choose. And a lot of you are paying it, and not everyone will use it. So that way, your risk is shared, and you've pooled funds, and you can access premium quality healthcare whenever you need it without having to pay.
Yeah, I like that you mentioned cost already, which is what I want to ask about next. But just to be sure or summarize what you said earlier, essentially it's that money that you put somewhere, you keep contributing it because one day you might need that service and you don't have money. So not having money won't stop you from accessing the service. You just go and access the service.
Yeah.
Essentially,
yeah.
That's incredible. I like that.
It's really cool. So, but okay, we'll get there, I guess, when we start asking some other questions. But so in terms of cost now, what is that amount now? Can we put an amount to it? So someone say, I want to buy health insurance for my family. I have 2 kids and I have a wife and she's pregnant, for example, or I think she's going to be pregnant, so we're working towards having a baby, another baby next year, but I need us to have health insurance. How much should they be thinking about? What's the cost implication?
So it really depends. So for government-owned or government-driven schemes like the NHIS, which is now NHIA, or for state health insurance schemes, for example, what they do is cost how much a basic minimum package would mean for a person, or for a man, his wife, and his 4 children. That's usually how it's couched. If you're single, it's just you. If you want to pay for a family member, you pay so it's usually costed per head, or per family, is what I'm trying to say. And it usually depends on how much the state or the scheme decides it will cost to provide a basic minimum package of services. So by basic, I mean, you have a fever, you go, you get tested, you get treated. For pregnant women, you can have your child at no cost and stuff. So they cost all of these services, right? And they put a premium to it. And they say, if you pay this amount, this is the range of services you would get. So there's a basic minimum package. If you want an additional array of services, this is how much extra you'd have to pay. That's usually how it's done. So you can have a package as small as 3,000, to be honest, even with private health insurance schemes. Yeah. There's a HMO that I think was advertising a package as little as 3,000. And you can, and it lists what you would get. You can get tested for something, or get tested or get treated for malaria or something. At some point, I think there's a package with the NHIS back then, now NHIA, that's cost like 12,000 for an entire year for a man, his wife, and his 4 children.
Interesting. So 12,000 per person or 12,000 for the family?
I will have to go and check. It's been a while.
Okay.
But I think it was actually 12,000 per person.
Okay.
Yeah, it was 12,000 per person back then. I don't know what it is now, to be fair. I think that now that the NHIA is in and they are, trying to finalize their operational guidelines for implementation, they might have reviewed some of these things. Yeah,
it would be interesting to have them. What do you think? Yeah, it would be cool to have them in the studio to talk about how they intend to do this. Yeah,
absolutely.
Make it work for Nigerians, how much they are going to charge, clarify some of the things you said.
You can work towards that for the next episode, I think. Yeah? Okay. Well, I think my main question is if it is optional, right? Because I know that before 2019, I did not know anything about health insurance. It was not a thing that I thought of at any point in time. It's not a thing that was that came up in conversation, even with like employers and things like that. So is health insurance optional?
It used to be, but in May 2022, the government signed a new law, the National Health Insurance Authority Act, and made health insurance mandatory for all Nigerians. So by mandatory, basically means all Nigerians. There's a list. There's people who are employers of labor, whether in private sector or in formal sector. People who employ people, I think who employ more than 5 people are mandated to give them health insurance and stuff.
Wow.
And everyone, essentially. So after that list that describes who health insurance is not mandatory for, the Act then just says everybody else. So even like people who are technically unemployed, it's mandatory for them? Yeah, health insurance is so the thing with mandatory health insurance is that it's a vehicle for universal health coverage. If you want everyone to have access to quality health care when they need it without having to go into financial hardship, then you have to make health insurance a mandatory thing. It can't be, if you want, you can subscribe.
Yeah.
Everyone should get health insurance. That's the new law.
Yeah.
How it happens.
It's not optional.
It's not optional. So how it happens is now the thing to think through for the NHIA. For formal sector, it's very straightforward. Just deduct at source or get the employers. So I think for formal private sector, for example, it's mostly employers who pay. Some organizations do part payments. They do contributory, what's that thing called? Counterpart payment. So the employer and the employee pay some amounts. Some just it's just the employer. For the government, for formal sector guys, it's government pays actually. For the informal sector, that's where there's a lot of thinking through to happen. How are you going to get the market woman, the Okada rider, the Keke Napep driver, the bus driver to,
because I think that's the thing that I would like to find out about. How are they trying to do that?
Maybe in that next episode you mentioned.
Yes.
Yeah. I like you said, question that Asari asked around what if the person is not employed? How are they going to pay? I also know, I hope we also get clarity on this, but I know there's also the thing about the vulnerable people. So, so if you can't pay, if you're classified vulnerable, then government can now take care of.
So that same act actually introduces the Vulnerable Group Fund, which will be funded by a number of things, maybe statutory deductions or statutory allocations or contributions and grants and stuff. And basically it would cater for vulnerable people. And the definition of vulnerable people usually, like for example, for other kinds of arrangements that the government has to cater to these guys, Usually you have pregnant women, children under 5, the elderly, the disabled. Obviously, the NHIA has to define criteria for vulnerable groups. I mean, there's a number of ways. There's a social registry that Nigeria has, which has a database of people who are classified as poor and vulnerable across states. The states actually contribute to the social registry. And those guys are the ones that are usually the benchmark that we use when we're trying to say, oh, we need to give palliatives, for example, because things are hard.
Yeah.
So those kinds of instruments can be explored for defining who the Vulnerable Group Fund would cater to. Anyway, so there's also other arrangements like that for vulnerable people that allows them to access quality healthcare, or at least the basic minimum package of healthcare services, and the government pays for them. So there's that arrangement as well.
Awesome. Cool. I like that you mentioned, so in the spirit of what we do here at the Break It Down podcast, which is essentially, simplifying everything. You said something earlier around basic minimum package of care. So I wanted to ask for you to break it down, but realized I wanted to also ask a question around benefits. So say someone pays, I'm paying premium, for my health insurance to cover me for 1 year. I pay that premium to government or to, the private guys. What am I getting? Also in the spirit of or context of that basic minimum package of care. So what do you get? I know you mentioned a bit of it earlier, but also maybe just try to explain it further.
Yeah, so we already established that it depends on what your premium is, right? But the basic minimum package usually consists of basic stuff like consultations. You can walk into the clinic and see a doctor without paying. Basic laboratory tests, like the simple ones, like a full blood count, like a malaria parasite test, for example. Urinalysis, those basic tests, right? Then it's also, I think, also x-rays as well, some radiological tests as well. If you need to get your chest checked, if you have a cough and stuff like that, those we typically cover. For pregnant women, it covers delivery. Some packages, for example, the FCT health insurance package, the basic minimum package for the FCT health insurance scheme covers cesarean sections as well. So beyond having and I think their premium is 12,000 or 12,500 as of the last time we asked, which was maybe last year.
Yeah.
And they cover cesarean sections and you don't pay a dime.
Wow.
As well as a spontaneous vaginal delivery. It's also some other kinds of care. I think that each state, for example, defines what their basic minimum package is.
Yes, okay.
The NHIS also defines what package. So depending on which package you subscribe to or which premium you pay, it defines clearly what services you would get. I think the onus really is on, the providers themselves, the providers of health insurance, to actually adequately educate people saying when you pay this premium, this is what you're entitled to. So you don't get bamboozled when you get into hospitals. But the onus is also on the public to know what they're paying for. So that you can demand for it. So when you go into a private hospital, for example, and they say this isn't covered, or when they give you certain kinds of drugs, and these are some of the concerns people have. Oh no, I'll get substandard treatment, I'll get substandard medication if I subscribe to health insurance. But if you go armed with the right kind of information and you have access to you can literally call your provider, your health insurance provider, and say, this is what's happening. And they would put that hospital on high jump. Just need to be aware.
That's interesting. Awesome. I like that because I keep going to the hospital and I keep receiving medications that I've never heard of before. And it really stresses me because I like ingesting things that I know. But
So you ask.
Yeah. That's it. I have to call my HMO and just ask, can I get this particular brand that I am used to?
And do you usually get it?
At the risk of indicting my current HMO, no, I do not.
All right. That is something I think that has been a source of concern for, I think, quite a few people. People get a sense that there might be some inequities, right, in the kind of care that they receive when they are on health insurance. And to be fair, it really is a function of what package you pay for. what premium you pay. It really is. But that said, there is the quality aspect of health insurance. Health insurance includes a number of things. It's equity, it's coverage, it's quality. You can't take quality out of it. So quality is central to it. So if you are getting substandard medication or you feel like the treatment you're getting isn't working because you're on health insurance, you need to take that up and raise an alarm, because quality is a central part of universal health coverage and you can't take that out.
That's great. Thank you. Okay, in the spirit of keeping to time, my final question is, what are some of the reasons why people do not get health insurance? So you've mentioned a couple here. Are there any others?
Especially wrong reasons. Those myths.
I think there's just a lot of misconception in these parts of the world about health insurance. People really don't understand what it is, and you'll find that states even decide to rename their own schemes when they start. So there's Nike, for example, in Niger, and it's the Niger Contributory something. Because once people hear insurance, they're like, God forbid, if I pay for health insurance, it means I'm saying I'm going to be sick and the blood of Jesus suffices and stuff like that. So there's that whole misconception about it. There's very little awareness. I think that the NHIA is very aware that the Nigerian public needs a lot of educating about health insurance. I think that came out very strongly in the last policy dialogue we held, Nigeria Health Watch. We had a panel where we had, we had a representative from the Cab Drivers Association. We had a market woman representative as well. We had people from core private sector. We had someone representing the disabled. And one thing that came out strongly from that panel is we don't know what you're talking about. We don't know what health insurance is. We are not carried along. People, and these are the people that the new law has to target. These are the people in the informal sector. So a lot of misconceptions. People really don't understand what it is, how it works, and that, I think, is one thing that really needs to be tackled as mandatory health insurance starts getting implemented.
Yeah, I completely understand that.
Yeah.
So it's interesting that you've mentioned this, because I was thinking to myself the other day that I probably wouldn't know about health insurance if it was not almost forced on me at my, by my employer. So how do we get people who don't have, they're not in the formal sector, how do we get them to understand and then appreciate the necessity of health insurance?
Yeah. Awareness. Need to create a lot of awareness.
It's a big task for the NHIA.
It is. I think they're up to it.
Yeah. I'm glad a lot of we are also supporting that, because as much as possible, we've tried to break it down in this episode. And we keep breaking it down and hoping that people understand what it means and go for it.
Yeah.
Yep.
Thanks so much for sharing your insights on this episode.
Thank you for having me.
Thank you so much, Kemi. And to our listeners, thank you for tuning in to the first episode. We will see you on episode 2.
Yeah, and don't forget to comment, share your feedback with us. Have you used health insurance before? Do you know someone that has used health insurance? What is their experience been like? What's your own experience? Please, we want to know so we can feed these things back into future conversations. And you can do this feedback. You can share these feedbacks via our social media platforms: LinkedIn, Twitter, Facebook, Instagram. Twitter, that used to be, X, that used to be Twitter.
The
last time we recorded it was
formerly Twitter.
Okay. X, formerly Twitter, Nigeria Health Watch. Please do share your feedback with us. And remember, this is a community. The
Break It Down community.